It's winter now and snow is falling and so are people.
That's right.
And one of the most common injuries that I see this time of year are wrist fractures or Colles fractures or distal radius fractures, which after the fall sends people right to the emergency room, then to their doctor, and then inevitably to therapy, whether it's a physical or occupational therapist.
So typically if someone has a wrist fracture and they don't need surgery, they're casted
Typically,
for
yes.
about 6 weeks, right? And then at that 6-week mark, they will go to the doctor will x-ray them and give them clearance to see you, an occupational therapist. And at that point, then what do you do?
Well, there's always paperwork to fill out. We want to get a good idea. I always have patients fill out a functional scale to find out, what are their limitations specifically, and a pain scale to know how they're doing pain-wise, how's their wrist injury affecting the rest of their life. At that point, I will conduct a full evaluation of their wrist and also further up the body to see if there are other limitations that have occurred because of the injury. During the initial evaluation, I will do some manual therapy, which will involve me either doing some passive stretching to the wrist or the joint. I know it's always scary because people think, oh, pain and torture, they're going to hurt me. And really our goal is not to hurt people, it's to help regain function in their lives. So it shouldn't be a scary process for people.
Is there a common time frame that it takes to rehab a person with a Colles fracture?
There really isn't. Some people, younger people, will rehab in just a few weeks. Some people don't need therapy at all. Those 16 and younger are very lucky. Some of the older population takes a lot longer. It really depends on how bad the fracture was, how much soft tissue damage there was, and how long they had to be in a cast.
Do you find that it's more the dominant or non-dominant hand in these cases?
It's 50-50.
50-50.
It's 50-50.
So now how often will a person come to therapy?
It's on an individual basis. Some people require 3 times a week. Some people after a really terrible injury require daily for a week or two. And some people it's once or twice a week. It really is individual. It depends on the person.
Gotcha. Now, in today's day and age, as a physical therapist, occupational therapist, we have to do a lot with a little.
Right.
And are you finding that insurances are limiting your patients' visits? And you have
Absolutely. And not only insurance companies limiting their visits, but the copays continue to go up and people can't afford to come in 3 times a week, which is the typical.
Gotcha. And so utilizing time outside the clinic is very important.
It's key. Now more than ever, people need to do their home exercise programs, and they need to do things outside of the clinic to keep their motion while they're not here. One of the tools that I use is a tool called Splint. So for someone who's lacking range of motion, I might put them in a splint to help aid with extension that they'll wear while they sleep, and it's a comfortable, they sleep in it, they wake up in the morning, they take it off, and we've been able to maintain or even gain some functional range of motion.
Great. And in addition to the extension, you can use it for flexion or supination,
You can use it for
pronation.
flexion, supination, pronation, elbow extension and flexion. They have a variety of products depending on the person's limitation.